Hello everyone, I'm Matt Elliott, and today I'm going to discuss with you ambulatory health care and health insurance. Ambulatory health care is defined as any outpatient care or procedure or medical care that is provided on an outpatient basis. Such services could include diagnosis, observation, consultation, treatment, intervention, and rehabilitation services. Many medical treatments for acute or chronic illness and preventive health care can be performed in an ambulatory care setting. Ambulatory healthcare centers can also provide minor surgical or medical procedures, most dental services, dermatological services, and diagnostic procedures. Those diagnostic procedures can include x-rays, endoscopy, and biopsy procedures of superficial organs, emergency room visits, rehabilitation visits, and even possibly telephone consultation. It is also noted that ambulatory care services represent the most significant contributor to increasing hospital expenditures and to the performance of the healthcare system in most countries. So, what this is saying in regular terms is that ambulatory care services is, the largest contributor to the cost of healthcare, especially in the United States. Specific sites of service for ambulatory care include hospitals, emergency room visits, physician clinics, dental clinics. Really, any type of outpatient medical procedure, wherever that may be performed, is going to be considered an ambulatory healthcare setting. And I also want to discuss with you now the history of ambulatory healthcare. Basically, prior to the 1800s till approximately 1850, medical practitioners were trained as a technical trade, such as, like an electrician or a plumber nowadays. It was only treated as, technical and not at a full educational level. So there was minimal licensing for students to become doctors. At that time, clergy members, so, your local preacher, pastor, or priest, or rabbi, or basically the religious figures of the society served as the physicians. And at that time there were not any regulations or on the treatments. So really, those individuals that were serving as physicians, they could try literally any type of home remedy and hope for the best. And at that time also the facilities were very primitive. Most hospitals were in the private homes of individuals. American hospital admissions were pretty much only for the poor, unmarried, or traveling patients. The lack of formal facilities really prevented the healthcare industry from growing. I also noted that the American Medical Association was founded in 1847. And then also at that time, what was known as the almshouse. This is where the poor of society, got treated. They really only provided basic food and shelter, and really didn't provide any other services at that time. Starting at around 1850, the United States began constructing actual hospitals. However, the mortality rates were very high. The hospitals weren't very clean or sanitary, for that matter, and they earned the nickname House of Death, because more people died that went to the hospitals than actually survived. Well-off patients, so people that were well-off in society, they paid for home health care, or not really home health care, but services provided in their home. So even residents in rural areas could have a traveling physician make a house call. So the well-off individuals would basically, have a doctor come to their home to perform services. Let's see, around the 1860s, of course, we had the Civil War. Soldiers at that time, were treated by volunteer nurses. One notable nurse at that time was Clara Barton, and she is the one that founded what today is known as the American Red Cross. Also, Louis Pasteur, he made big advances in microbiology, and he helped develop the principles of vaccinations that has expanded into what we know it as today. Around the 1870s, the Medical Practice Acts were passed, which this allowed each individual state to have the authority to grant medical licenses. In the 1880s, anesthesia services were improved. In the 1890s, X-rays were discovered. And then moving on to about 1900 to the 1930s, technology advanced. This is also about the time that automobiles came into play. So this made physician consultation easier because people that could afford to have an automobile were able to actually go visit the physician, or the physician was able to come see them and could get to the patient much quicker now that we had automobiles. And also around this time, physicians organized as an actual profession. In the 1940s, hospitals became more efficient, cleaner, and safer, and they were able to provide enhanced and specialized services. Next, I want to talk about Medicare and HIPAA. Starting with the Social Security Act in 1965, this act was signed into action by President Lyndon Johnson, and Medicare is basically a government-sponsored insurance plan for persons in the United States age 65 and over. Medicare is divided up into different parts. Part A covers your hospital stay benefits. Part B covers the physician charges, and Part D covers the prescription drug coverage. Part A is generally covered at 100% for the covered person. They don't pay any type of premium or monthly charge for Part A. However, Part B, there is going to be a premium attached, so the covered person is going to have to pay a monthly premium. Plus, those physician office visits are probably going to have some type of copay, whether it be $20, $25. Same thing with visiting a specialist, and a specialist copay may be more, $35 to $50. And again, this is just hypothetical, depending on the Part B coverage that the covered person has purchased. Part D, it again is going to come with a supplementary plan, and so there will be a premium attached for the prescription drug coverage, and again there's going to be co-pays involved for the medications as well, or even a possible deductible. For example, maybe there's a $200 deductible that the individual has to meet before the plan begins to pay anything on those prescriptions. There could also be co-pays involved, so say hypothetically, generic medications, might be a $10 copay. Preferred brand drugs, so this is going to be the brands that the insurance plan prefers to be prescribed. They might be $30, whereas non-preferred brands that are still covered under the plan might be $50. So again, those are just some examples. And then moving to the HIPAA, which that stands for the Health Insurance Portability and Accountability Act of 1996. There were three objectives that HIPAA focused on at that time, and that was the portability provisions, tax provisions, and the administrative simplification provisions. which basically, the third component, the administrative simplification provisions, were regulations concerning the electronic transmissions of health information, and how that data would be protected, and the privacy of the individual would also be protected. Next, we have the Veterans Health Administration, TRICARE, the Indian Health Service, and Workers' Compensation. The Veterans Health Administration is the largest integrated health system in the United States, and it serves more than 8.9 million veterans each year. The VA basically only provides services for those individuals that have served in our U.S. Armed Forces and are now, retired or disabled. If they were discharged, whatever the case may be, that they're, a veteran if they've served, in any war, anything like that. So the VA provides services for those individuals specifically. TRICARE is the insurance coverage program for members of our U.S. military and their families. Generally, the active duty service member, TRICARE insurance is provided to them, completely free of charge. They don't pay any premiums for their self. However, there are premiums attached for, their spouses and any of their dependents. And generally, this coverage, they'll have a copay for their doctor's office visits, and for their specialist visits. There may possibly be a deductible attached, and same thing with the medications. They're, possibly have a deductible or a copay plan depending on whether they're getting a generic or a preferred brand, whatever the case may be. TRICARE also has a provider network, so as long as you are seeing a provider within the network, you'll get full benefits. However, if you see a provider outside of the network, your out-of-pocket expense could possibly be more, because again, they're not in that contract. They're not in the network, so they're not receiving those contracted rates. Next, we have the Indian Health Service, and the Indian Health Service provides health services for approximately 1.9 million American Indians and Alaska Natives who belong to 567 federally recognized tribes. The Indian Health Services has worked with our U.S. government and with the local government of the Indian tribes to devise a health plan that will help improve the lives of the individuals that are in these tribes. Fourthly, we have workers' compensation, and basically workers' comp, as it's most commonly known, provides coverage for on-the-job injuries. So if you're at work and you get hurt, your employer has a workers' compensation program. So the first step, you would obviously report your injury to your supervisor or manager, and then they would work to get you the appropriate forms to complete. You would be assigned a doctor to go see for the specific injury, and you wouldn't pay anything for these services. The insurance is paid for completely by the employer, and any of the medical charges and everything, again, is going to be paid for by your employer. You would not be responsible for these charges. Lastly, I want to discuss briefly the Affordable Care Act. This act was signed in 2010 by President Obama, and in a nutshell, the Affordable Health Care Act mandated that health insurance coverage be provided for all persons, whether that be an employer-sponsored health plan. So, if your job, offers health insurance coverage, this would be one option. Secondly, if you're, self-employed, or if your employer coverage is what would be considered affordable. There's also individual health plans that are sold through an exchange. And basically the exchange, you can think of it as like basically a shopping mall for insurance plans, offered by different companies, whether, to use Arkansas for an example, on the exchange we might have Arkansas Blue Cross, we might have Qual Choice, we might have Ambetter. Those are just 3 different companies that provide health insurance in the state, depending on what county you live in. So, again, you could use the exchange to purchase a health plan. Thirdly, there is the Medicaid expansion, which not all states opted to expand Medicaid through the exchange. However, Arkansas did. So the Medicaid coverage is for individuals of low income, or their income is within a certain percentage of the federal poverty level. And the Medicaid expansion plans, or as we know it as Medicaid private option, provides insurance free of charge to individuals that meet the qualifications, and even their medications are, again, they'll have no copay for doctor's visits, they'll have no copays for their medications, or depending on what their income is, they might have a $4 or an $8 copay, depending on the medication, whether it's a generic or a brand or whatever the case may be. The Medicaid eligibility requirements are determined individually by the state that the person resides in. So, for instance, Arkansas is going to have different Medicaid eligibility than New York. That's just an example. Another thing I want to talk about is, the cost of health care. The Affordable Health Care Act, in my opinion, has not really made insurance affordable for everybody, nor do I personally think that every individual should be forced to purchase a health insurance plan, or, get fined on their taxes for not doing so. I also believe that, especially in Arkansas, where we've expanded our Medicaid through the exchange and the Affordable Care Act, because these individuals are still, they're still getting the same benefits as anyone else that's on any type of commercial health plan. So, they're still getting to see the same doctors, they're covering the same services, for, specialists. Even sometimes they have coverage for services that, paying individuals don't have at all. For example, infertility is one example. So for couples that for whatever reason can't have children, these plans cover infertility services so that to help a female get pregnant, whatever the case may be. However, me personally, my employer plan doesn't cover those services at all. Another thing is, again, with the coverage of the medications, because they're still allowed the full formulary options. They're still able to get not only generics but brand name drugs, sometimes at little to no cost at all. Whereas, again, people on regular commercial plans, not only are they paying a premium, but they're having to pay copays for the doctor's visits. They're having to pay copays or deductibles for the medications, and some of these medications are thousands upon thousands of dollars a month. Depending on what the condition is. Just one example, we'll take hepatitis C for example. There's quite a few new medications out to treat hepatitis C. However, these medications, if purchased outright, are between $28,000 and $30,000 a month. Yes, I said that right. $28,000 to $30,000 a month. For a month's supply. So people that are on the Medicaid expansion plans, again, assuming that they meet the coverage criteria for these medications, they're getting these medications at no charge to them. So the insurance company is paying, again, almost $30,000 a month just for that one medication. So you multiply that by, any number of individuals, it gives you an idea of, how astronomical the cost of healthcare really are. So while the Affordable Health Care Act has been great for some, it hasn't been great for everybody, and I believe that there's still a lot of room for improvement. Thank you for your time today.